Welcome back to Einstein's Eyes. Good to see you all. I'm Carl Rosen, oculoplastics neuro-ophthalmology in Anchorage, Alaska. I've been here for 30 years. My partner and co-host and friend who I did my residency with at Albert Einstein College of Medicine, Jon Ditkoff. Jon?
How you doing? John. I'm an ophthalmologist, been in practice for 30 years. I do general ophthalmology, specializing in cornea, and I'm in northern New Jersey. And it's nice to see Carl in Alaska. And we got an interesting topic today that I'm sure a lot of people out there want to know more about.
Right. It's a fascinating topic. It's really about a medication that you can think of as two medications. And it kind of blurs the line between medical necessity and cosmetic enhancement. It's called Latisse or Xalatan. They're both prostaglandin analogs. The scientific name is bimatoprost, and it has an interesting story. Actually, the doctor who identified that this drug that was originally used for glaucoma caused increased eyelash thickness and growth was Murray Johnstone in Seattle, Washington. And I actually spent a couple of weeks with Murray when I first got to Alaska to brush up on glaucoma and trabeculectomy techniques, since I was one of the only ones doing it at that time back in the early 90s. And Murray was just fantastic guy, gracious to have me, fantastic surgeon, but he actually identified it and patented it, I believe. So that's another story. But we're gonna talk about some context. And both Latisse and Xalatan belong to a class of medication, as I mentioned, called prostaglandin analogs. Originally developed to lower intraocular pressure in glaucoma patients, but it had a surprising effect, eyelash growth. And this created, a big interest in the beauty community, and it created a sensation. And this is where it gets interesting, because this drug does have some risks and some trade-offs. And some of the trade-offs are really, not completely understood. Like, it can increase the pigmentation around your eye, as well as your iris. It can reduce fat and cause something called a superior sulcus deformity, or a sunken eye. Now, that was a paper that came out in 2022, 1 out of 680 patients. So it's not a lot, but it still exists out there, and you guys should know about it. And that's what our channel is here for. And for glaucoma, it was a game changer. It increased the aqueous outflow, or the fluid in the eye, to lower the pressure and prevent optic nerve damage. It was once a day dosing, minimal side effects. One that you do need to know about, and Jon can talk about this a little bit more, is that it causes sometimes inflammation in the eye. It can reactivate herpetic infections, very rarely. Jon will mention that. And also macular edema in the back of the eye. So it's all about this inflammation, and that's what the prostaglandin class of medications can activate. So Jon, take it away. What do you think?
So I didn't call. I did not know that specific person. I've always told patients it's a really interesting story, because we're all these ophthalmologists. We're using this amazing medication, which has been a game changer, like you said, and once a day, very safe. So even though you mentioned some risks, they're extremely rare. I mean, for glaucoma patients, it's really rare to see any problem from latanoprost, bimatoprost, any of the medications. That's why they're so popular, and that's why there's so many of them now. Having said that, we just kept seeing all of our patients coming in with all these eyelashes. In fact, some people even had eyelashes that would be growing in a little bit. That was much worse, because their lashes were rubbing against their eye. So, yeah, I mean, I always thought of it, the company came up with this idea, but that's a great story. And so going forward, so Latisse, first of all, a lot of the risks that Carl mentioned with the medication are for ocular use. So it's very, very important when you're out there using Latisse. And there's actually studies that show, they actually took the Latisse and they put some green dye with it, and they showed that if you do it properly, only 5% of the normal dosage that a glaucoma patient would get goes in the eye. So if you're doing it properly, really, you're not really at risk for any of these ocular. The most important thing I tell all my patients, so the dosing. Latisse comes in this bottle that Carl showed, with this little brush that comes with it. And it's a sterile brush. And there's 2 brushes per dose, meaning you're supposed to use 1 brush for one eye, 1 brush for the other. And you're supposed to do it once a day in the evening. And what you do is you take it, you dip it, you kind of squash it and, the excess, and you just do it across your upper lid, right where the lashes start. And if you do it properly, as I was saying, almost none of it gets in your eye. And if you do it properly, where you're really just going along your lashes, really you're not going to get the pigmentation issue. Because the most common problem I see in patients is if they put an eye drop in their eye of this medication and they don't blot out the excess, meaning if you don't wipe your skin after you do this, then you will get pigmented skin. You can almost get like a tattoo kind of dark mark. But again, if you're doing it properly, where you do it right along your lash margin, and just in case you can take a little tissue and blot it. But what I tell all my patients, what I would tell all of you out there, they have a very good website. And you go on there, they have a video of the proper way to do it. And that's what you should do before you use it. And if you do that, it's extremely safe. It is costly because your insurance is not going to cover it. And it does work. It takes usually about 6 weeks until you start to see the lashes growing. And the lashes will not only grow more, but they'll become thicker. So it can make a real big difference cosmetically. But the thing you should also know is if you stop using it, completely regresses. You lose the effect quickly. So within a month, all the improvement will go away. The other thing that's kind of interesting that some people do is they put it on their brow. So some women, men, they want to thicken their brow. It actually works there. It's not approved for that use. The FDA never approved that. So the manufacturer will not give you guidelines on how to do it, nor will I. But I will tell you that people are using it off label and they're getting a good response if people have very little brow. They're also, while we're on the conversation, it's kind of interesting for hair loss. So a lot of the hair loss clinics that use finasteride or they use minoxidil. Minoxidil is the big one that you basically put on your head. They will mix some of this medication into the minoxidil, and that supposedly gives a little bit better effect as well.
That's interesting, John. I didn't know that.
Yeah, pretty interesting. But the one thing I don't know about is, does that pigment the scalp? I'd be a little bit cautious because if you put it on your scalp, well, of course, pigmented spots, I don't know.
Right. Yeah, I don't know either. Yeah, but Murray Johnstone was a guy who identified this. Very interesting story. And my partner, Elizabeth Morgan, who's a glaucoma specialist at Ophthalmic Associates, she trained with him. So it was coincidental because I was there in the early 90s. She came a little later. So small world.
Yeah, but it does work and people love it. I mean, there's a lot of patients that ask for it. I find it is expensive. So for some people, it's just not worth it.
Right. So that's great. So thank you, John. And thanks for tuning in to this episode of Einstein's Eyes. If you found this discussion helpful, please feel free to share, like, and subscribe, all that good stuff. And we will see you on the next one. So long. Good seeing you, John.
Bye-bye.